What is a virtual placement? How can a placement really be run digitally? Will students really be able to meet the learning outcomes and proficiencies? Will there be real professionals mentoring and facilitating the placement? These are just some of the common questions we get asked. In this short video, we'll answer all of these questions and more to briefly explain what a virtual placement looks like. Virtual placements are run by the team at Health Academy. Health Academy was established as a multi-channel primary and community care training organisation. The primary aim of the organisation was to improve the quality of clinical training with the use of a range of technologies and approaches. During the COVID-19 pandemic, Health Academy were approached to develop a practice placement model that could be delivered using a virtual approach. The precondition that we set ourselves within Health Academy was that any placement had to bring quality and value to a student's education. Our placements had to be forward-thinking and be relevant to current and future practice. We set ourselves the very ambitious target of making sure that the next leaders in healthcare will be prepared for the digitization and new ways of working in healthcare. This is just a sample of the great team of clinicians that we have working on these placement programs. Every placement will have a lead professional. Depending on the placement type, they'll take the role of the practice assessor, or practice supervisor, or practice educator, or long-arm supervisor. Throughout the placement, students will meet with their lead in both group workshops and in one-to-one sessions. As well as the lead professional, the students will also have sessions with other professionals in the team who will also offer facilitated sessions and support sessions. Unlike any other placement, our clinical team's overarching focus is the learning needs of the students. The student is always number one. So what do the regulatory and commissioning bodies in the UK say about virtual placements? NHS England, the Nurse and Midwifery Council, the Chartered Society of Physiotherapy, and the Health and Care Professions Council wholeheartedly embrace and approve of innovative placement provisions such as the virtual and simulated environments. These professional bodies and regulatory organisations understand the potential of virtual placements to improve healthcare education and training, providing unique opportunities for students to gain practical experience in a safe and controlled environment. By embracing this technology-driven approach, these bodies recognise that virtual placements can help ensure that future healthcare professionals are equipped with the necessary skills and knowledge to deliver high-quality care in an ever-evolving healthcare landscape. COVID-19 pandemic was undoubtedly a catalyst to health services embracing the concept of virtual placements. However, it was the catalyst rather than the cause. In the UK, we have an ageing population, as well as an ageing health professional population. Currently, there is a massive shortage of clinical professionals across all fields. We're in a perfect storm of increased demand with limited professionals to deliver the care. Our approach to healthcare has to change and look at new technologies and ways of working to improve efficiency. Health services in the UK have historically taken a cautious approach to change, particularly in the field of technology and digitisation. Often the decision makers resist embracing new technologies as they may not fully understand the capability or potential of them. In addition, accepting new digital solutions often means relinquishing control, which for senior decision makers, this can be quite challenging. The COVID-19 pandemic broke down all of these barriers. Across all areas of healthcare, there was a rapid adoption and the use of digital solutions. The adoption of many of these systems proved that we can work differently and more efficiently. The majority of these new systems have remained post-pandemic. Our virtual placements embrace this culture change. In every virtual placement with Health Academy, we explore not just what healthcare looks like currently, but how students, the future leaders in healthcare, can use technology and digital solutions to improve the quality and efficiency of patient care. There are so many ways in which virtual healthcare has become the norm following the pandemic. From home monitoring, virtual wards, digital health promotion, NHS apps, and all the way through to video calls with our GP. These are here to stay. So what actually is a virtual placement and how is it built? Every virtual placement we build is different. At the outset, we work with the university to understand the needs of the students and liaise with the university throughout the build. Central to any placement structure is the need to meet the regulatory requirements. Every placement will have a theme running through. Students will have a programme of work which will involve using a range of digital tools that are relevant to their area of practice. The placement is likely to be made up of clinical skills, group facilitated workshops, development of digital tools, independent research, case scenarios and management, use of electronic medical record systems, patient consultations, and much more. Throughout, there'll be support from the Health Academy team, including workshops and one-to-ones. Every student will be enrolled on the Health Academy Practice Portal. This portal has a schedule for every day of the placement, explaining exactly what each day will look like and what they'll be working on that day. The virtual placement model is continually evolving and growing. At Health Academy, we are now specialists in the development and delivery of virtual practice placements. These are just some of the universities that we work with to deliver high-quality practice placements. Every placement we develop is bespoke to the individual university needs. We currently run a number of different placement models. These are just some of them. Our NHS Health Check placement for nursing students has had a number of different formats and versions, which a number of universities have adopted. We have a very successful MSK placement for physios that we've developed a Year 1 and Year 2 version of. This has also been embraced by a number of different universities. As part of a wider piece of work, we have developed a multidisciplinary placement which has been accessible for all branches of nursing and AHPs. In addition to our fully virtual placements, we have also embarked on building a number of hybrid placements, where we work in partnership with physical placement environments and the students have a mixture of physical and virtual placement. We also have a whole range of additional placements in development. So most importantly, what do the students say about our placements? Every student gets an opportunity to evaluate their placement, and as a result we've been able to adapt and improve every area of our placements. In general, we find that how students feel about the placement before they start is relatively negative. This is often due to the lack of understanding of what a virtual placement is, and also the communication they receive beforehand. However, by the end of the placement, this is how students feel. Generally, through all of our placements, 9 out of 10 students would recommend this placement to their peers. Our ambition is to get that up to 10 out of 10, but we think 9 out of 10 is a great start. These are just a handful of comments from students, but overall most students are extremely positive about their experience. It's really important to understand what our virtual placements are and what they're not. They are the only placement where the student is the number one priority. Every placement is practical, interactive, challenging, and engaging. All placements are designed to reflect the changing digital landscape in healthcare. And we review every placement and health environment to keep the placement relevant, and we're constantly finding new ways to improve the experience. So what are they not? The virtual placement is not a last resort because a university has nowhere else for a student to be placed. The virtual placement is not a second-rate placement. In fact, on average, the virtual placements are often rated higher than the traditional placements. Students often worry that they will not be able to achieve their proficiencies and competencies. We have this covered. Every placement has been designed to align with the frameworks such as the CPAF and PAD to ensure that they are achievable. Now, finally, our virtual placements reflect up-to-date best current practice. Thanks for watching. Whether you're a student who may be joining a virtual placement with Health Academy, or a staff member from a university that would like to explore more what Health Academy can offer, we're always happy to hear from you. Please feel free to contact us.